I am proud to introduce Dr. Leo Morales. He is Assistant Dean for Healthcare Equity and Quality in the School of Medicine with the University of Washington and co-director of the Latino Center for Health at the University of Washington. Welcome, Dr. Morales.
Thank you, Nina. I'm going to pull up my slides here. And I just want to start by saying thank you, Nina, for inviting me to be here. And thank you to the Latino Civic Alliance for the invitation. It's really quite an honor to be here as the son of immigrant parents and someone who was born, raised, and educated here in Washington State. Today, I'm going to be talking a bit about the COVID-19 pandemic and its impact on Latinx communities in our state. My name is Leo Morales. As I mentioned, I'm a physician. I co-direct the Latino Center for Health along with Gino Eisenberg from the School of Social Work. I also have the role of an assistant dean and an appointment as professor of medicine at the University of Washington. I have no conflicts of interest to disclose. And a word about our center. Our center is a state-funded interdisciplinary research center that focuses on really improving the well-being and health of Latino communities in the state of Washington. So here's a brief update on where we are with the pandemic. I think we're all aware that cases have leveled out, although we still have a fairly high level of transmission occurring. Over 100 cases per 100,000 is the last rate that's available from the State Department of Health. Of course, we're probably underestimating this rate because testing is much more difficult to capture now that we have at-home testing. But what we are very happy with is the fact that we have fewer hospitalizations, so people are getting less sick. And that's primarily due to increased immunity, both because of prior infection and because of vaccinations. In terms of variants, we've been mostly dealing with Omicron variants for quite a long time now, and it appears to be, there still are new variants of concern, but Omicron variants seem to be the ones that are predominating. So this doesn't tell the whole story, and this is really what I want to share with you today, is to say, the disparities in the pandemic have not been equally borne. The impact has not been equally borne by different communities in our state. And here we have three charts that show you the age-adjusted case rates, the hospitalization rates, and the death rates. And in all cases, you can see that Latinos in particular have been disproportionately impacted. So case rates are 48% higher among Latinos compared to non-Hispanic whites. Hospitalizations rates have been 87% higher also compared to non-Hispanic whites. And mortality has been 115% higher compared to non-Hispanic whites on an age-adjusted basis. And what this speaks to is really the higher burden of this pandemic that has been borne by Latinx communities in our state. This is important to keep in mind as we think going forward, because the impacts of this pandemic are still being felt and will continue to be felt for years to come. In terms of vaccination status, we've done a good job of catching up in terms of vaccinating Latinos, at least in the primary series. So you can see in the first two sets of bars, the comparison between Latinos and non-Hispanic whites in terms of initiating their primary series, completing the primary series, whether that was 1 or 2 shots, depending on the vaccine. Receiving any booster, you begin to see a tailing off, and then receiving a bivalent booster, which is the most recently released booster, you see now that Latinos are lagging behind once again. So I wanted to spend a minute talking about long COVID. So the earlier data about hospitalization rate and mortality speaks to the higher severity of illness that Latinos have borne, not only infection, but also severity of illness, leading to hospitalization and ultimately, sadly, in terms of death. What this does is suggest that there is a higher rate of long COVID in the community because long COVID is related to COVID infection severity, along with other risk factors, which I'll mention in a moment. The pie chart, really, what it's showing you here is data from the US Census Pulse Survey recently done The last wave release was in January 2023. And approximately 22% of those asked who identify as Latino in our state said that they had COVID symptoms that lasted 3 months or longer. This is consistent with long COVID. 1% of those mentioned that they had been impacted highly by these symptoms. Another 10% said they had not had severe impact or lower impact, and 11% did not respond to the question about the severity of their symptoms. What this means, if we look over here at the right-hand side, given our population of Latinos in the state of a little over 1 million, is that approximately 225,470 may have long COVID symptoms. That's the 22% of the million. And that approximately 12,000 of those are probably suffering from high impact, another 100,000 from low impact, and 112,000 we just don't know. So related risk factors, as I mentioned, are COVID infection severity. So having more severe illness, like that leading to hospitalization, older age, type 2 diabetes, female sex, obesity, asthma, and poor mental health. And I'll share with you some of the prevalence of these risk factors in the population. Obesity is a problem among Latinos in our country and in our state. And what these charts show is the obesity rate on an age-adjusted basis among those who are 20 years of older on the left-hand side and those aged 2 to 19. And you can see with the light green bars being representing Latinos, approximately 47% of those aged over 20 and 26% of those 2 to 19 years of age currently have a problem with being obese. This predisposes to poor outcomes with COVID and to the onset of long COVID. On an age-adjusted basis, diabetes is also higher among Latinos. This is data for the United States. And what it shows is that Latinos have approximately 20% prevalence rate. This is among those 20 and older of having diabetes. About 6% of those cases are undiagnosed. This data was drawn from a examination survey, so didn't rely on medical records. Was directly, the information was directly obtained from the population. We know that the pandemic has had its own problems in terms of causing mental health problems. And here's data from the Pulse survey, again, early January. And what you can see here, this is data for Latinos in the state of Washington. And you can see that there's a fairly high prevalence of symptoms with, for example, responding to the question around depression, having little or no interest or pleasure doing things, or feeling down or depressed on the left-hand side. Oops, sorry. You can see here that, between 20 and 30% are saying several days of these symptoms, somewhat lower some of the days, and nearly every day between 7 and 12%. Similarly for anxiety. So depression and anxiety are common symptoms that people are feeling. So the social determinants of health really are related to our general health status and are important to address because they are related to health. And increasingly, I think our public health and healthcare systems are responding. But here we have some data, again, from the Pulse survey on food security, economic security, and health insurance status for Latinx and white individuals. And I just want to share with you here that you can see food insecurity is higher among Latinx, with more responding that they have either sometimes not enough to eat or not enough to eat of the food they want. In terms of meeting household expenses, Latinx individuals are more likely to say it's somewhat difficult or very difficult to meet those expenses. And in terms of health insurance status, 14% of Latinos responding to the survey identified as not being insured, compared to 3%. So quite a big difference there. And health insurance, of course, is a key component of gaining access. So even among those who are insured, having a usual source of care is hugely important. And so even among those who are insured, being able to be identified with a clinic and have access to a primary care provider is something that Latinos do not have in the same proportion as other groups. This is national data and showing that usual source of care, not having a usual source of care is higher among Latinos than other groups. And I believe this is also true for Latinos in our state. So having concordant care in terms of language and ethnicity leads to better outcomes of care. And what we know is that in our state of Washington, about 13% of the population identifies as Hispanic or Latino, but among those practicing physicians in our state, only 3% are. So this disparity is not only the case in terms of physicians, but is also true for other healthcare professions like nurses, dentists, physical therapists, occupational therapists, and radiology techs going on down the line. So Latinos find it harder to find that concordant care in terms of language and culture. Language, approximately of those asked what language they speak at home, this is for Latinos in the state of Washington, only about 40% say they speak only English at home. So Spanish is spoken in approximately 60% of Latino households. And among those, approximately 25% identify as speaking English less than very well. So language access, either through bilingual, bicultural staff or through the use of interpreters, is very important. And high quality interpretation is key to making sure there's language access. So in summary, these are some of the challenges that we've seen through the COVID pandemic and I think are worthy of consideration now. So Latino communities throughout the state of Washington have been disproportionately impacted by the pandemic. That's evident in the data. Latino communities are again lagging in terms of COVID-19 vaccination rates, especially with the newest bivalent vaccine. And so ongoing and renewed efforts to vaccinate at the community level are needed. Latinx communities are an elevated risk for long COVID-19 and long COVID and COVID-19 complications. So these chronic illnesses that we've been talking about as predisposing to long COVID are also occurring in higher prevalence after having had COVID. So there's some association between having COVID and developing problems related to the heart, related to diabetes, related to stroke. And so it's a double effect. Both rural and urban Latinx communities lack adequate access to care, including access to linguistically and culturally concordant care, which we know is related to better outcomes of care. And that needs to be addressed through workforce reform. And finally, we need more research to understand the long-term impacts of the COVID-19 pandemic, not only on Latinx individuals, but also their families and communities. What has happened as a result of the pandemic in terms of the businesses, the jobs, and the children who have not been able to attend school on a regular basis, in addition to those individuals who are directly impacted by the complications and the sequela of COVID-19. So with that, I thank you for your time, and I'm happy to entertain any questions or move on.
Thank you, Morales. This information is extremely important, actually very concerning. I think, as you know, that many organizations like LCA and many that are joining us today, our community partners, participated when the pandemic broke to help with getting, encouraging Latinos to get vaccinations, COVID testing. And more recently, when a lot of the, when Governor Inslee dropped, the mandatory mask, and there were a lot of changes in the county, what we are hearing and seeing is that talking to Latinos around the state, they kind of have this belief, not everyone, that COVID's gone. It's no longer nothing to worry about. And so what I'm concerned about is that funding has really dropped to support community organizations to go out and do this community work. I would assume you're concerned about that as well.
Absolutely. And I think the other thing that we've learned through doing this community engaged work is that it is an important way to reach those who are least well connected with the healthcare system. COVID-19 is a concern. Vaccines are important. But there's also the backdrop of all the chronic conditions that go untreated and unrecognized. So I think there's a huge need to improve access to care.